Hello! Today we're going to be talking about directional terms within anatomy, within health science. So where something is or what direction it's in. So the terms are here on the board. Let's get started from the top. Notice that all of these come in pairs. So first there's superior and inferior. Superior means heading up toward the top. Inferior means heading down towards the bottom. Now these are comparative terms. So for instance, my chin is superior to my navel, but it's inferior to my nose. So it depends on what you're comparing. But it's also a direction. If I'm heading this direction, my blood comes up from my legs, it's heading superior. But if my blood is pumping down toward my legs, it's heading inferior. So it's both a direction of movement as well as a comparison of two things. Similar but not identical is this idea of cranial versus caudal. So cranial, cranium, means head. Cauda is a word root that means tail. So this is very similar to superior inferior, but it's only in the trunk. So within the spine or within the abdomen. If you're heading toward the head, you're going cranial. If you're heading toward the tail or the end of the backbone, then you're heading caudal. It does not apply in the legs. It does not apply in the arms. It's just something for the trunk. Next we have anterior and posterior. Anterior means towards the front. Posterior means toward the back. If you're familiar with some of your Latin roots, ante means before and post means after. So kind of the before and after. Anterior, posterior. Medial and lateral. Medial sounds like middle or the median in the road. So medial refers to the midline. If I'm heading toward the midline, then I'm heading medial. If I'm heading away from the midline, I'm heading lateral. Similar with these other terms, something can be medial compared to something, lateral compared to something else. So my eyes are more medial than my ears, but they're more lateral than my nose. Next we have proximal and distal. Now proximal and distal only apply within the same limb. So you can only use them in the upper limbs or the lower limbs, but only in the same one. It doesn't have any application to the head or the trunk. You can't compare two arms or two legs or an arm or leg. You just pick one limb. These terms are within that limb. Proximal, think approximately or proximity. It means close. So close to what? Where the limb attaches. So if I'm heading toward where that limb attaches, I'm heading proximal. If I'm heading away from where my limb attaches, I'm heading distal. So my elbow is more distal than my shoulder, but it's more proximal than my wrist. The same thing works in the legs if you're talking about the knee compared to the hip or knee compared to the ankle. Lastly, we have superficial and deep. Superficial means surface level. Deep, obviously, is going away from the surface. Now, this can be for the whole body, where my skin is most superficial, and then I go all the way down to my bones and the bone marrow, and that's most deep. But it can also be the organs itself. If you take a bone, which is deeper than skin, but within the bone itself, there's the superficial layer around the outside of the bone and the deep layers there in the middle. So it always depends on what you're comparing to. Superior, up. Inferior, down. Cranial toward the head, caudal toward the tailbone. Anterior toward the front, posterior toward the back, medial toward midline, lateral away from midline. Proximal towards the limb attachment site, distal away from the limb attachment site. Superficial toward the surface or surface level, deep away from the surface.